Okay, well, thank you everyone for joining us on this webinar presentation on securing FEMA funding for COVID-19 related costs. I'm going to try to keep this webinar to about 40-45 minutes. We have a lot of information to cover, and this is structured truly as an educational webinar. You will receive this deck afterwards. If you email me, I'll send you the deck. It is meant to be a resource guide. There's lots of information, and I also have other resources like spreadsheets, information from FEMA that we've all collected to make this process for you seamless. So there's a lot of information. We've done our best to make it concise and in a way that you can, what's the best information. So I will get this out to those who want it. It is meant to be like a workbook and a resource guide, and we have other materials. So welcome. All right, just give me 1 second. Okay, so my name is Lisa Miller. I am the CEO and founder of iHealthcare, and I've been working in healthcare for over 20 years in hospital healthcare non-labor costs. And since 1999, we have a team of specialized healthcare subject matter experts in non-labor cost who have been supporting hospitals and healthcare organizations in thousands of engagements and projects, and those range from cost engagements, analysis, project management assessments, to organizational-wide cost reduction initiatives through spend data analytics and supply chain strategies. So we are an independent boutique advisory firm to hospitals and healthcare organizations on non-labor costs. And so we're approaching this educational webinar from the cost standpoint. There are other resources that can guide you and help you in other areas of the COVID-19 kind of FEMA application process. However, our expertise is costs, and we're going to go through this webinar and from a cost perspective, which is very, very important. A little bit about our cost thought leadership. You could see it on our website. Been working with hospitals in various different degrees, as I said earlier, focused on cost. And I'm going to jump right in. So this educational webinar is specifically focused on understanding what's allowable, capturing the costs to date that you've incurred, in documenting those costs, and how to procure those costs going forward, and having an auditing and monitoring system in place. I was recently on a FEMA presentation. It was interesting that they even said this is the first time there's been a FEMA recovery for a pandemic event. So there will be costs and activities which are newly reimbursed and require expertise in healthcare costs and to capture all those related to COVID-19. So under the grant funding, the following is a list of those eligible items or eligible costs for federal reimbursement. And that's the virus testing, it's PPE, it's shelter, emergency care, provision of food, water, ice, other essential needs, EOC operations, and security for temporary facilities. And this is how the public assistance overview works. You have your local, state, and then FEMA takes in, and of course, all the states have a declaration of emergency. Again, this presentation, I probably won't go through every single slide, but it was really meant as a resource and a workbook. So I've taken the most important parts of formulating how you're going to assemble your cost and condense this for you as really an expert resource guide. So I want to start, and we always will go to the FEMA resources, and some states have some great resources too, but we're going to what's factual to present to you what's important. And this is the FEMA fact sheet, and it's a nice overview of what's required, what's needed, and through this process, really, also how are they going to, more than likely, will be auditing. There'll be probably lots of post audits of costs, and really it's so important. You want to be able to justify and secure everything in it's accurate, and it has the documentation in place, and how you construct that's so important now, because more than likely these will be costs that will be audited, and you want to ensure that you followed all the procurement guidelines, and the contracting practices are very important. So there are 4 tiers of eligibility. We're going to start with the bottom, which is application. So it's application, facility, work, cost. Again, I'm going to be going through a lot of those application parts quickly. Probably most of you have filed, at least started the application, but we're really going to talk about cost in more detail. So you're probably familiar now, there's a grants portal, and you've got to sign in. You've got to get a user account if you've not registered. In order to register, you'll need DUNS number, your tax exempt form, and these are all the documents that you'll need to register. But I'm sure everyone at this point has registered. If you're not, you could reach out to me. We could kind of help you through that process. So this is the grants portal, and you'll see different applications. This is the actual application, and we'll go through what is needed in different sections. And again, this webinar is not about how to fill out an application, but it's really talking about the cost aspects. But if you've got questions, we are here to help you. And we'll talk a little bit about the different schedules. There's a Schedule A for use for expedited funds. There's a Schedule C for use if work is in progress or not started, and that's more than $131,100. It's required, 100% documentation is required by FEMA. Schedule D is for use if work is completed, so it's in progress or not started, and is $131,100 or more, required for all large projects. Schedule F is required for all projects. It's documents of environmental and historic preservation requirements. And there's a Schedule EZ. It's for use if work is complete, in progress, or not started, and it's less than the $131,100 D mark, and that's for small projects. Again, in the grants portal, you'll see these documentations. You'll have the work, contract work summary, material summary. These are all in that portal. You'll have a documentation checklist, and they really walk you through very, very nicely on how to submit an application. Some people may, want to work with somebody who has, gone through that application process, but they certainly make it very user-friendly. And because this is a new event, being a pandemic, they encourage questions, because a lot of these questions relates to cost and making sure that you're getting everything that they will reimburse you for. And I think that's really important that you have that dialogue. There's a cost workbook, which I'll also show you shortly. And the Schedule EZ replaces the self-certification projects used in previous disasters. It requires a FEMA summary sheet found in the grants portal. It requires certification that documentation is held by the applicant. I'm going to probably say this a couple of times, but it's interesting. Once you upload everything to the portal, that is not, that won't require or substantiate a future audit. So you're going to need to have those same documents that you uploaded, that you keep in your facility, your organization. That is that's required. So if they come in and they do an audit, you've got to have that documentation that was uploaded. That uploading does not fulfill that requirement. So there's a couple of things I'll really talk about, but I think that's really key, that you have this documentation on site and that same documentation that you've uploaded. So now we're going to move into facility. I think everyone on this webinar, for the most part, is a hospital or a healthcare organization. So the eligible facilities that they're, the PNPs, and the facility requirements are: damages must be caused by the event, They must be the legal responsibility of the applicant and located in that declared county and in active use at the time of the emergency and not under another federal agency. So these would, PMPs would include nursing homes, labs, rehab, hospitals, fire, rescue, educational facilities. And then essential non-critical private nonprofits or community centers, childcare, food assistance, performing arts, senior citizen homeless shelters, and houses of worship. And now we're going to move into the third pillar, which is work. The work performed must be required as a direct result of a declared emergency, which COVID-19 is, must be a legal responsibility of an eligible applicant performing the work, located in a declared county and completed within regulatory time limits. As I said earlier, it's a small project versus large project. The project minimum is $3,300 regardless of the project size. Large projects are over that $131,100. State requires 100% documentation on all projects. So information required for a project, it's got to list those damages, insurance information, list of paid staff, regular overtime hours. Fringe benefit information is key. List of equipment used, the hours of operation, date, times, miles. I'm going to give you some examples today, but the list is just completely exhaustive in terms of how you've got to measure and track these costs. The list of materials and supplies purchased and used, contracts, copies of contracts, invoices, your procurement policies. I mean, really putting this from a cost perspective, a project perspective is so important. And we're going to go through a little bit more of that. Various parts of a project, it's that basic information, it's this damage description, scope of work, cost estimates, and again, those attachments. And not only the documentation of cost, contracts, but proof of payment is very important. I think there's a couple of interesting aspects and in terms of the contracting, it does make sense that because this is FEMA reimbursing for this event, that it must comply with all state, local, and federal procurement requirements. And for the work that's going to be that future work, it has to be competitively bid, and they're very, very strict about following those procurement procedures. And we're going to cover a couple of those areas, but and we don't have time on this webinar. I'm thinking about really kind of going through the FEMA procurement guidelines on a separate webinar, but I will include in this resource guide another a guide on that procurement that's very specific to FEMA and specific to this event. So there's two types of contracts. There's a lump sum and time and materials. The lump sum is easy to monitor when the scope of work is well defined. It requires minimum labor for monitoring, and the quantities do not have to be documented. Time and materials should only be used, emergencies must have a cap and must be monitored. This is New York. Every state has their own kind of place where they can, location they can go in terms of adhering to federal, state, and local procurement requirements. But it's really important. It was interesting on the FEMA webinar. They talked about. It'll be in the next couple of slides, but I'll mention it here. One aspect is that they require that when you're going out to bid, that you actively pursue WMB, so women minority businesses. So it's not just putting it in a newspaper, it's actually reaching out actively, pursuing and getting women minority businesses procured in this process. So documentation requirements, when you look at it from an organization, labor and equipment, it's pre-disaster personnel policies, it's names and hourly rates, it's the logs. I mean, this is just a monumental task of really getting those employee activity reports, the timesheets, really by 15-minute increments, even fringe info, as I mentioned earlier. Equipment inventory, the make, model, horsepower, size, the hourly cost, a piece of equipment. Again, it's invoices and proof of payment. And now we are going to talk about the cost part of that, of the 4 pillars. So the eligible costs are labor, equipment, materials, contracts, management costs. Costs must be reasonable and necessary to accomplish the work. They have to be compliant with federal, state, and local procurement requirements. And they have to be reduced by any credits such as insurance and other funding. So all that insurance dollars and other kind of funding has to be taken off of that, those costs. And so FEMA will reimburse the organization's 75%, and we'll talk in a minute about one strategy, and they recommend too, on the 25% that's responsible, that you're responsible for. Ineligible contracts are cost plus percentage of cost. They're contingent upon FEMA reimbursement and contract with debarred contractors. So they are not eligible contracts. I took a snapshot of the application because the procurement under grants public policy is so key. Again, you'll get that after the webinar, but there are a lot of rulings up. There's a lot of details under those policies and procedures that now we have to follow in order to get the FEMA recovery cost. And there's some special considerations. There's key areas that you have to focus on in insurance. FEMA will want documentation to show that any applicable insurance covered was pursued. So they want to know that even if everyone thinks that this will be denied, they still want the organizations to pursue insurance coverage and really document that you have, and whether that's been declined or any amounts have been received, but they want to know that you've done that. And then any kind of duplication of benefits, federal and state funds received to combat the virus will have to be deducted from any eligible project if used for any portion of that project. So we're going to talk a little bit about those items that will be reimbursed. They are purchased or used from the stock. I think that even though there is I would say probably resources and supply chain and operations are challenged right now, I think it's important that there needs to be a look back and really an understanding and start assessing what was used, so that you can capture all those costs that were used from stock. Most people are starting to put processes in place of what they've purchased, but even so, we've seen a lot of gaps in that process, and it really has to be well documented. So I would encourage everyone to kind of go back and make sure anything that was used from stock, you start now and document that. Used for eligible work, and it's important. Invoices, historical data, quotes from local vendors will be required to justify costs. So again, just, how are you pulling those PO reports? Can you get those invoices, data from your materials management systems? I mean, I would start compiling that information right now, particularly as it relates to what was used right off, from your stock, and even things that were procured. It's going to be important to have that baseline, because that baseline pre COVID-19, and then as that day hit, different organizations, you're going to have to you want to be able to get reimbursed for everything and be able to make sure it's accurate, relevant, at the right price. You can justify it and document it. Again, there's just a wide range of areas that that will be covered. We're going to cover a few. This is performing eligible work for, let's say, auto or trucks, and it's important that the mileage or an hourly rate is captured. A half day or more is considered a full day. Less than a half day is actual hours, and that's going to be key, because there's certain things that FEMA will be look for, when there's an audit, and You have to really be careful on those decisions. And so little things like every single truck or car used was a full day will be a red flag, and then that will be audited. So you really want to be careful that either you're looking at that half day or more, or less than a half day, and accounting for those actual hours. Another eligibility of cost is for the non-congregate sheltering that requires a tracking mechanism to be established to demonstrate eligibility of cost reimbursement with the following information, right? You need specific individual need, length of stay, and cost. The tracking mechanism you put in place should not disclose personally identifiable information protected by the Privacy Act, but so you have to put in place some kind of system, whether it's a record number, but you've got to put in an individual need, length of stay, and cost, and this will be important also to make sure you capture accurately those costs that were incurred during COVID-19. Management costs. So they are required to manage projects administratively. They do not include cost incurred for actual work to complete a project. So those are site identification, gathering of costs, site visits, scope development, project reporting, travel costs, recovery, transition briefings, applicant briefings, even your time here, document. So if it's 45 minutes or an hour, document this time. This time is allowable time. Management costs, they call category Z. They're direct and indirect administrative costs incurred to submit a process for your FEMA project. So it's actual costs must be fully documented, and they're capped at 5% of the applicant total obligated project cost. So I had this slide. I should have had this slide earlier, but it is interesting. They talk about it on a FEMA website. They have published this. They're they talk about it a number of times. Applicants must be able to demonstrate direct outreach to MWBE's enterprises. It's been in law for 5 years now. They do audit this, and it's not just posting in a newspaper. It's direct outreach, and you could see it in the procurement documents we'll send to you. Funds are lost if applicants don't ask questions. Got to ask questions. They want questions. Obtain FEMA pre-approval to change scope of work. If you don't follow procurement protocols, if you don't follow the scope of work in the projects, if you don't meet PA program deadlines, and keep clear, complete, and accurate records. It's huge. It's going to be a monumental task. We're supporting hospitals and helping them in this cost area to accurately get the cost, to document, to put it together. It's so important because you don't want to have a situation where you're jeopardizing your reimbursement because you didn't keep complete, clear, and accurate records. This is the public assistance reasonable cost evaluation. Again, I'm not going to go through in a lot of detail. I do encourage you to read this because it really talks about factors to consider in determining reasonable cost. And so a lot of these costs, they're going to, not a lot, some of them are going to come down to reasonableness. And there is a validation of applicant provided cost estimates, and they encourage, preparation by somebody who, can certify the estimate or prepared, that has expertise. And it's very, very important in this process to have that kind of cost expert on your team. And these are some of the examples of worksheets. Again, if you want some of these worksheets, we'll send them out to you. There will be a personnel cost worksheet, so you have the name of the person, you have their title, their status, the date, their hourly compensation, and as you can see all the way through with their benefits, and just tracking to this level of detail is not, this would be great. This is a requirement. The equipment cost worksheet, you can see the ambulance, truck, the code identifier, hours used, the rate, and then the total cost. Expendable supplies worksheet, it's the vendor, the description, the use, the quantity, unit price, total price, date purchase, use. Again, this level of detail is required. And the incident tracking worksheet, which would tie into those costs. And then, of course, a combined cost worksheet that would include everything: personnel, equipment, materials used. Some of you already may have had a PPE calculator. This is one that FEMA recommends, and it's something that you may already have in place, or that you may want to use go forward, or maybe put your data into this spreadsheet. But it is a really great, very intuitive spreadsheet that allows you to document your COVID patients are being treated, the start time, what was used, number of days supply that's remaining, the boxes of PPE used per patient, average consumption per day. But they're very intuitive. You just need someone that's going to be, putting this information on a daily basis, probably even twice a day. So donated resources. FEMA will reimburse 75% of the cost. The 25%, you can deduct donated resources and add to that 25%. So volunteer labor, donated resources, there's a number of different donated resources that would include in this category. And again, you'll get this as a resource. And this is directly from the FEMA site. It talks about the eligibility. So it's donated from a third party, and it goes through what they considered that would be allowable. I pulled these from a couple of different places because I thought these were great questions and seemed like questions that would get answered. We're not taking questions on the webinar today. You can certainly email me. I can take questions via email or via phone call. But I thought these were really important and relevant. So what is the recommended timeline for applying? It's immediately. They haven't cut off. Usually it's 6 months from the start, but from the start of the incident. But it looks like that maybe will continue longer than we think. What is the timeline for receiving funding? It just depends on the nature of your claim and the quality of your supporting documentation. If the full scope of a project is not known at a time, can projects be revised after submission? And the answer is large projects are routinely amended and called versions. That's very common. Small projects are not and should have a very clearly defined and limited scope of work with a solid cost estimate. What are the required documents? Applicants must complete a full request for public assistance package. It's an RPA package. Will applicants have to complete a preliminary PDA? And the answer is no. So won't read through all these questions. I just wanted to kind of highlight a few. It was interesting. Of course, PPE is reimbursable. Yes. Are legal fees covered? No. And I think that's an important one. I've heard people say yes, but this comes directly from FEMA. Are costs added to contracts, monitor, document, and account for projects and costs eligible for reimbursement? And the answer is contracting for and monitoring contracts would be a project cost, not a management cost. That's an interesting nuance. Documenting and accounting for the project would be a management cost. And you also have FEMA and your state to also assist you with grouping your costs if you've got a question. But I thought that was an important distinguishing area of cost. Working from home is not, like if you're using Zoom, that's not covered. What is the maximum amount one can request? There is no maximum. It's truly it's based on those costs incurred. And one area I want to talk about for a minute is if permanent staff are quarantined due to COVID-related concerns, are salary and fringe costs reimbursed as the absence of that staff is directly related to COVID? And the answer is no. The question underneath it is the one I wanted to talk about. Are cleaning services reimbursable? And this one's important because a lot of hospitals have outsourced their EVS, and those that have them insourced are bringing people in or maybe adding supplemental outsourced services. So an eligible applicant may seek reimbursement for reasonable and necessary costs for disinfecting in common areas to prevent spread of the virus. For example, a hospital may incur costs for more frequent disinfecting of areas where staff, patients, members of the public potentially exposed to the virus are meeting for purposes of diagnosis and treatment. This would include not only testing in treatment rooms, but also labs, waiting rooms, lobbies, cafeterias, hallways, elevators, stairwells, and restrooms. This is really important because we're seeing a huge spike in those EVS costs. And so that would even go down to the supplies if you're working internally, but I would actually have a project worksheet just for this area of spend cost. So your next steps are to confirm your applicant profile in the grants portal, start building your project worksheet, and gather your documentation for submission. Some great resources, and I'd encourage you to, maybe to look, kind of go through a few of them. Some of these are 400-600 pages, and we've kind of done that work, but I encourage you to, if you're interested, there's Public Assistance Guide. These are both from FEMA. And I think some of the big takeaways for today for you is to have a plan. There's an incident action plan, emergency plan. There's two forms, the 202 and 204, but have a plan. You want to tell FEMA what you did, right? It's critical, those incident logs and those reports, and then describe what you spent and why. And that will be, from the cost perspective, it's the documentation. So it's payroll records and policies, it's collective bargaining agreements, inventory lists, receipts, contracts, but it really is the 1, 2, 3. Have a plan, tell us what you did, describe what you spent and why. And FEMA really is about document, document, document. This is from the FEMA website. It is so important that, this will be burdensome for hospitals on the documentation part. We are supporting hospitals and helping them get those costs documented and put it in a package so that, everything is accurate and that shows justification in a real line item detailed way. So I'm going to end here. We have lots of resources. I really wanted this to be an overview on the cost part of getting an understanding of what you can apply for, not necessarily the application process, but the documentation process, or how you internally now need to get your hands around those costs. And we're here to help. We're cost advisors on your team to assessing costs, ensuring accuracy and relevancy, cost documentation, so you have a complete records of costs maintained at your organization. And for those events that will happen post-COVID, there's a lot of activities that will happen afterwards. You will need cost monitoring and cost auditing for those large agreements. And I had one more slide, but it's not showing up. So I want to thank everyone for coming. You will, if you're interested, you can have this resource guide. We have other resources. If you'd like to schedule a call with me, I would love to, to talk with you. And we will be doing other webinars. We'd like to keep them short to like a half an hour, 40 minutes, but we are going to be adding to this. There's a lot of changes. And a lot of additions. So we want to keep, our clients and those in the healthcare and the hospital field that are supporting, on the business side of healthcare, we want to keep you informed. So look forward to hearing from you, and have a great day. Thank you.